Hi, Dr. Henter. Thank you for taking the time to sit with us today to have a conversation about the clinical research journey of HLH. We know recently you reviewed an article published in the New England Journal of Medicine about HLH, and we thought we could have this opportunity to build off of your review article to discuss where we came from in HLH and how far research has advanced. Can you
Okay.
start off and share, your personal professional background and how you started in treating and studying HLH?
So I'm a pediatrician and I'm focused on pediatric hematology and oncology. But actually, already during my first semester in pediatrics at the Karolinska University Hospital, I met a child, a 1-year-old boy, with HLH. And that kind of triggered my interest. And then a couple of years later, uh, during the winter time, we had like 4 patients in my ward with HLH. And at that time, it wasn't really written so much about it in the books. So I thought, here is something. So we have a disease that is with a high mortality, unknown etiology, and not that rare. So I thought that was something that I could focus on.
Oh, that's beautiful. Thank you. So first, how has the survival rate in familial HLH changed over time, and what is the current standard of care treatment and the current survival rate for it?
So when we started, and this is a while ago, it was in the 80s, early 80s, then there was no child with familial HLH that had survived long time. So that was like kind of 0% long-term survival. And then based on experiences in different countries, we put together, and there were good studies done, such as in Paris, in France. But based on the knowledge we had in 1994, so that 1 decade later, we developed a treatment protocol called HLH-94. And with that, we reached like a long-term survival of 50%. So that was a big step. Once again, it was based on on studies from other colleagues, and that was based on etoposide, dexamethasone, and cyclosporin. And this basis still has been used a lot. And in a very recent study from the International HLH Registry, which is which has its main center in Germany, the survival in the etoposide-based regimen for primary HLH has now reached a 77% 3-year survival. And to me, this is a large step from the 0% we started in. At an early time point, and this is a little bit personal, but at an early time point, I thought if we could get like 9, because there are 2 steps in this treatment. First, the initial treatment to get the children alive for a prolonged period, and then the transplantation to exchange the immune system. And I thought if we could get children to survive, for 90% of the children to survive to transplant, and then 90% of the patients, the children to survive the transplant, that would be 81% long-term survival. And I thought that would be kind of my dream goal. And we are very close now.
And I'm pretty sure you guys are going to make it. So that's such a huge, change, which is amazing. What are some of the major long-term concerns in the treatment of familial HLH?
So what we have come to learn is that this disease, HLH, which is like a encephalitis all over the body, it also comes into the brain. I mean, not only bone marrow or liver or spleen or lymph nodes, it also comes into the brain. And in the brain, it causes brain inflammation, encephalitis. And this disturbs the brain. This results in brain damage. And since the brain has not so much of regeneration, these, as the liver has and the spleen has, because there is a rapid regeneration, but not in the brain. So this means that the damage that has been made there remains. So what we have realized is like 15 to 20% have a long-term brain dysfunction. And this is, I think, the major concern with regard to treatment, how to reduce that morbidity.
Yeah, and with that, have studies on biology of familiar HLH have any value for understanding human biology beyond HLH?
So this is an interesting question. Actually, I think this is fascinating because not only has the studies on familial HLH increased survival markedly, it has also contributed to the understanding of human biology, and more specifically, how we, all of us, downregulate our immune system. Because so when we get a viral infection or any inflammation, the body, we get fever and we upregulate our immune response. But how do we downregulate it? And this was not actually well known until studies on familial HLH revealed some of the genetic defects, such as perforin and the perforin gene and the perforin gene system, the other genes involved in the same regulation, and showed actually that perforin and the perforin system is essential for downregulating immune response in humans. And this was not known, and even the function of perforin was not known until the studies on FHL started. So we have FHL has contributed to the understanding of how immune response in human is downregulated, which I think is a big thing.
Right. And with the support of like the Histocyte Society and the Histocytosis Association, how many lives do you think have been saved as a result of that?
I think it's difficult to tell because this disease comes in all countries. But I came to discuss with a colleague in China, and I asked him this question because China is a highly populated country. And they also well aware of HLH in China, so they treat a lot. And I asked him this question. He thought that about 5,000 lives, something like that, in China alone. Adding other countries to that, maybe 10,000. But this is a wild guess, and it's based on the estimate of a colleague in China. But anyhow, many lives have been saved, and many more can be saved, actually.
Right. I'm pretty sure the goal is to save as many people as possible.
Absolutely, to a good life as well.
Yeah,
So that's an
exactly.
important part. Yes.
What are the major challenges when it comes to the study of HLH?
This is a kind of difficult question, but so because HLH has so many components, but when we look at the primary HLH, the familial form, then with now reaching around 80% or long-term survival, I think that a major challenge is actually to reduce the long-term complications so that the lives of the children that grow up is a good life. I think that's the major challenge. And in order to get there, we need to spread the message out so that the children are treated earlier before they get the brain damage, so that as soon as it is escalating, the disease is escalating, treatment is initiated so that the brain is saved. But I think actually the main problem or the main challenge is with regard to secondary HLH, because that is much more common, much more frequent, and it occurs in so many different settings in ICU and infectious diseases departments, in units, and to get the awareness among all the physicians in all those different departments worldwide, to get the awareness of HLH so that they think of it, check ferritin, and initiate treatment early. I think this is the major challenge in one way. And then we in the histiocytes community need to know where we should focus their attention, which diseases, which situations should particularly the colleagues be aware of HLH in. I think that we have come to export the knowledge from primary HLH to a secondary HLH in many aspects, because the knowledge was born in pediatrics, and the knowledge was born regarding primary HLH. So we have exported the treatment components such as etoposide, corticosteroids, and other drugs, anakinra, ruxolitinib, and then emapalumab has been added as so that's one part. But what we also very recently, in a publication by Dr. Lachmann in Germany, showed that the diagnostic criteria that we use in pediatric HLH for the genetic form can be valuable also in adults with the secondary form. And this is a big difference in population, but they show that these criteria developed for children can be quite valuable also in a large multi-continental study, 13 cohorts all over the world. So also diagnostics have been kind of exported into the secondary field in adults. So treatment and diagnostics. So I think this is a big step.
Right, absolutely. Is there anything else that you would like to share with the HLH and the histiocytosis community?
I got one thought now just popped up, but I think that the Histiocyte Society and the Histiocytosis Association, I think, should be very proud of what the communities together have accomplished, what has been contributed to the medical society. Because if the Histiocyte Society wouldn't be there, with the support of the Histiocytosis Association, we would not have met. We would not have been able to make these large studies, these international, multi-continental studies, on which our knowledge is based to a large extent. So with the Histiocyte Society, we were able to meet, we were able to decide and design of international studies. And they are the basis for the knowledge that has been developed. So I think the contribution by the Histiocytosis Association and Histiocyte Society has been very important and still is.
Right, the importance of supporting one another and advancing. Dr. Henter, we appreciate you for your time and your expertise, sharing your knowledge with us, and all that you do for the histio community. Thank you so much.
Been a pleasure. Thank you.